New freedom tonight for those lucky enough to be fully vaccinated against COVID-19. Good evening. I'm Haley Harrison. The CDC now says vaccinated people can get together without masks or social distancing. They can also visit unvaccinated people as long as they're considered low risk. KMBC 9's Brian Johnson explains more of the recommendations and how people are reacting.
With each shot, more Americans, especially grandparents, are able to see loved ones and socialize for the first time.
She drove down to the beach with my parents, so things are looking up.
The CDC says starting 2 weeks after your final shot, fully vaccinated individuals can now visit in small groups without masks or distancing, indoors or outdoors, with another household that is or is not vaccinated.
I think it's pretty great. I think it's great. If more people are taking vaccines, it's definitely good for the society.
The feds also say vaccinated individuals don't have to quarantine or test if exposed to COVID-19.
That's a pretty astounding recommendation and guidance point. And I believe it says unless you have symptoms. I think that will help everybody moving forward.
It sounds like it's optimistic and we're heading the right direction, but it's also I don't want anybody to jump the gun too quickly and for everybody else to suffer the consequences.
The CDC still recommends people wear masks near high-risk individuals or if you're near people from multiple households. Brian Johnson, KMBC 9 News.
The CDC still does not recommend non-essential travel because 90% of Americans aren't fully protected. Well, tonight, nearly 500 new cases of the coronavirus and 19 new deaths were reported in the Kansas City metro. That spike in deaths is likely due to updated death certificates. Let's take a look here at the spread of these cases over the 9-county area in the last 7 days. Johnson County on the Kansas side and Clay and Ray counties on the Missouri side both saw an increase in the percentage of new cases. All right, well, almost a year into COVID-19 and so much has changed, including how we get tested for this virus. KMBC 9's Jackson Kurtz reports on Kansas City's testing efforts since the early days of the pandemic.
I think the biggest change is the change in demand.
At one time, getting a COVID-19 test in Kansas City was a challenge.
We had lines of cars and actually had more people show up than we had tests. The biggest challenge at that time was putting things together and not knowing what resources were going to be available.
But now, months later, the number of people wanting to get tested has significantly dropped. So much so that Kansas City Health Department officials say they're ending their community testing program this week because of that lack in demand and increase of vaccinations.
We have to acknowledge that reality of people don't want testing now, they want to be vaccinated.
A massive contrast to early on in the pandemic when testing options were limited and there weren't too many testing sites compared to now, where you can get a COVID test at a pharmacy, grocery store, or even at home.
We knew we would eventually get to this point. It was just a matter of when.
Health officials still urge the importance of being tested for the virus.
We still need to be doing enough testing to ascertain exactly what the amount of disease is that's spreading in the community.
In Kansas City, Jackson Kurtz, KMBC 9 News.
A big change here. Now, the average number of daily new tests across the Kansas City metro is about 1,300. That is compared to more than 6,000 back in late November. And for the first time in the pandemic, St. Joseph Medical Center in Kansas City now has no patients in the COVID isolation in the ICU. The Mid-America Regional Council says the average daily new COVID-19 deaths are at their lowest point since July. Doctors say the decrease in numbers is giving frontline workers a much-needed break.
As the year went on, as some of our nurses were affected by COVID, either personally or by having family members that have COVID, therefore they couldn't come to work, then we started having a staffing crunch. So more patients and less nurses.
The hospital is currently treating COVID patients, but right now they do not require intensive care. Doctors say they're bracing for another possible surge after spring break.